Hello, my name is Brian Gifford. I'm the Research Director with the Integrative Benefits Institute. Today, Aaron Peterson and I are going to walk you through the findings of our most recent study on substance use and abuse among U.S. workers. We're going to go over the main findings, and then we're going to review expert guidance on developing effective substance use policies. For employers, this is going to be an opportunity to evaluate your policies against practices. And for suppliers, if you administer clients' policies, this is a good opportunity to conduct a review of the kinds of services you provide against the best practices from the perspective of the field. A little bit of background about IBI and why we conducted our research on opioids. We're a nonprofit organization focused on workforce health and productivity. We have over 1,000 corporate members, mostly employers, who are managing the health and productivity of their own workforce. And if IBI has a core message, it's that while everybody knows that illness has business costs, we remind business leaders that health in fact creates value. And it creates value by enabling people to show up for work consistently and feeling well enough to put in a good performance when they're on the job. And if they do this, they stand a good chance of doing all the things that companies hire them for in the first place. They make the things a company sells, they sell the things a company makes, they educate students, they take care of patients, keep the buses rolling. Whatever the business model is, this actually applies to it. It's a business model that's so simple, in fact, that in the field of health and productivity, we almost never talk about it. Not because it's obvious, but in practice, it's very difficult to find and use data that can bring this simple picture to life in a way that is meaningful for business leaders. So even if you are able to show that your programs are helping people become healthier, it's very difficult to link that to their absences on the job, their performance on the job, and if you can link those things together, it's very difficult to then link it back to whether or not your company is producing more of whatever it does. And if you can make those links, it's still another step to show that because of that, your company is actually performing better as a business. So we do the next best thing and we focus on illness-related lost productivity from sick days, from disability lost work time, and from impaired performances on the job, which you may know as presenteeism. Now, that simple business model also has a tendency to get lost when we confront national emergencies on the scale of the opioid epidemic. So when we see over 1,000 overdose deaths each week, not to mention suicides related to substance abuse, not to mention the human toll that the epidemic has taken on individuals, on their families, and on communities, it can seem appropriate to discuss the epidemic in terms of its impact on business operations. But these impacts are nonetheless real, and they present an opportunity to engage the business community as stakeholders in helping develop solutions. Now, typically the focus on business issues when it comes to the opioid epidemic has been on workplace safety and on hiring challenges in parts of the country that are heavily impacted by opioid addiction. But one of our concerns was whether these issues paradoxically gave a lot of employers a false sense that the opioid epidemic was not their issue. There's, of course, the stigma of street drugs, which may give employers an opportunity to say, while we recognize the importance of this issue, those frankly are not our employees. And this may be the case among companies that are not engaged in heavy industry, where worker safety and the liability for worker safety are going to be of primary concerns. So we set out to shed light on the extent of substance abuse and substance use among workers in terms of both appropriate use and problematic patterns of abuse and dependence. And to do this, we use nationally representative data from one of the agencies within the Department of Health and Human Services, the Substance Abuse and Mental Health Services Administration. We use data that were collected from 2015 through 2017. Over this period of time, almost 85,000 people answered questions about their use of different types of substances. And their responses were coded according to rules that were designed to indicate patterns of abuse or dependence. So nowhere in the survey were people asked questions that said, do you have a problem with your use of this drug or that drug? Instead, they were asked a battery of questions about whether or not their use of different kinds of substances impacted their ability to work, their relationships with other people, how they felt. And Aaron Peterson, who is the first author of this study, is going to tell you a little bit more about the primary findings.
It's Brian mentioned, I'm Erin Peterson, and I'll go over the findings as well as guidance for employers to deal with the issue of opioid use in the workforce. Let's start off with our findings. We found that about 1 in 20 employees showed patterns of abuse or dependence of prescription pain medications. The concern here is that this puts them at higher risk of later use of more dangerous substances such as heroin or fentanyl. As you can see in this chart, pain relievers are abused at higher rates than other kinds of prescriptions, more often than illicit substances such as cocaine, but less often than alcohol or tobacco. However, the abuse and dependence of opioids accounted for just a fraction of the use of pain relievers. While 1 in 3 employees reported using pain medications, most of this use was as directed. This points to a larger epidemic of pain and a problem with pain management in the workforce. Here we're showing the number of days associated with the use of each substance in the past month. As you can see, users of pain medications were absent from work twice as often as employees who didn't use them. Here we're bringing the baseline to non-users. So it's the same information as the last chart, except we're highlighting the difference between the absences of substance users when controlling for non-users. The takeaway here is that prescription medication use is related to more absences than other substances. These numbers reflect a hypothetical 1,000-person workforce, but what you can really see here is the magnitude of pain reliever use compared to other substances. In fact, more absences are associated with pain relievers than the rest of the substances combined. And in fact, it's the appropriate use of prescription pain medications that is the largest driver of lost work time than any other substance or type of use. This really points to a high level of functional impairment related to pain and problems due to pain management. The main implication of these findings really goes to show the widespread problem with chronic pain, which reveal the effect of pain management on employers. That said, pain management approaches that minimize the risk of opioid abuse may improve productivity as well as help curb the epidemic. Now that we've talked about our findings, we'll move on to what you can do about pain management and prescription pain reliever use in the workforce. We spoke with several experts in the field to provide guidance for employers. Their advice came down to 5 broad recommendations. These guidelines are both preventive and reactive, so there should be relevant takeaways for those who have already taken note of issues in their workforce and those who would like to focus on preventing problems from coming up. I'll go into specific advice for each category in the next several slides. I thought we'd start with a way to gain an understanding of employees' risk for developing a substance abuse problem. This allows employers to prioritize resources for their workforce and hopefully allow for proactive approaches. 2 ways to do this are outlined here. Health risk assessments can identify employee issues and medications employees are taking that may have potential for abuse. In addition to asking questions about various substances, legal, illicit, and medications, also make sure to ask about acute and chronic conditions that pain medications could be prescribed for. Knowing the prevalence of these conditions and various substance abuse problems already in your workforce can give valuable insight into your employees' health. However, because these questions can be highly sensitive, it may be necessary to partner with a third party to ensure employees answer these questions honestly. Tracking overall spending and trends for opioids and other prescriptions with the potential for abuse can help both on the patient and prescriber side. It can allow for the identification of drug-seeking behaviors. A few red flags of which are early refills, the use of multiple prescribers for a single employee, and the use of multiple pharmacies for a single employee. Tracking can also identify specific providers who prescribe at high rates. Tracking can be best accomplished by working with a group health carrier or pharmacy benefits manager. Including employees and managers in strategies can be helpful to combat problematic pain-related behavior. Training and education for supervisors on their roles when they suspect an employee has a problem can help manage employees at risk of developing problematic use, and also provide guidance for employees who are already showing signs of problems. Beyond being a first line of defense and being able to identify problematic behavior, they can help shift the culture around substance abuse. Sensitivity training can help destigmatize substance abuse and other behavioral health issues. This will make it more likely for employees in need to seek help. Promoting employee resources can also help in destigmatizing substance use and encourage them to seek help. Providing these resources can ensure they get the care they need. Employers can also publish a formal drug-free policy. This lets employees know what is expected of them and what to expect should they violate the terms. Since a third of employees may take pain medication, it's important to help them manage their pain so that their medication use doesn't become abuse. There are several ways to do this. If an injury occurs, it's best to focus on rapid access to treatment and refer the employee to a pain management specialist. These can be medical personnel, but other pain management approaches can include psychologists, acupuncture, and mindfulness meditation. Certain injured employees also have a greater risk of developing chronic pain. Understanding these risk factors can help better manage employee well-being. Cognitive and emotional factors can also indicate whether pain will become chronic. After an injury, coordination between multiple groups can help the employee get the most effective treatment. And finally, return to work strategies can be hugely beneficial. These include graduated returns, flexible schedules which allow for treatment adherence, temporary job reassignment, and work accommodations like ergonomic design, regular stretch breaks, and postural change. Some employees will likely still develop problems with opioids or other substances. Approaching these issues like a chronic condition can help patients access evidence-based treatment resources. Doing this can help them both with quality of life issues in addition to allowing them to resume their role at work more quickly. Partners are important and have expertise and resources that an employer may not. When finding partners, make sure they have clinical experience. If you're using drug testing facilities, ensure the labs are federally certified, that they screen for opioids, and that their testing policies and procedures have been vetted by an attorney. Partners can also help ensure policies conform to regulations such as HIPAA, ADA, FMLA, and local sick leave laws. Thank you for your time. If you have any questions, feel free to reach out to us via email.